Welcome back to the Unstuck movement. I'm host Rob Z. This platform was created for you to find breakthrough in your life. So we have true testimonies of breakthrough on this podcast to give you hope, to give you an example, and to give you strength. Today we're talking healthcare, innovation, community, entrepreneurship, impact, among so many other things with Donny Beaver. Donny, it's amazing to have you here, and I love to dive in with a powerful question right up front.
Let's go.
So let's go back to you starting the Gloria Gate CARE and this healthcare mission that you've been on for the past couple of years. You were saying that you had lost your wife 4 years ago, which really was the impetus for you launching Gloria Gate CARE. Can you walk me through that process and what made you, after so many years, finally decide to make an impact in the healthcare community?
Yeah, well, thanks for having me, Rob. I really appreciate it. I've been on this journey longer than I knew. In that having a bunch of businesses that I've been fortunate to co-found or be the founder of, and we've employed literally thousands of different people through the years and bought healthcare for all of them. And I couldn't understand why in the 1970s. I could cover a whole family of four for $129 a month with no copays and no deductibles. And now this year, believe it or not, the average family of four all in healthcare costs are $28,000. And so that's copays, deductibles, premiums, out of pocket. And so I've always been bugged by that. And in the last 25 years, it's gone up at twice the rate of normal inflation. And it's been uncontrollable. So that's always been in the back of my mind. And we'd like to provide healthcare for our associates and friends that work with us. But so that was always a tension that I knew was there, but I didn't personally deal with it directly every day. So it's just like, oh, gee, we have to write a big check again. Here we go. And then probably it probably started in the early 2000s. Well, actually late 90s. My wife had a 12-year period where she had something really wrong that we couldn't figure out. We traveled all over the country to try to crack the code. I literally had the luxury of taking off work to do it. And my kids were in high school and grade school and high school. And unfortunately, I got really frustrated with the right hand didn't know what the left hand was doing. Every time you went from here to the Cleveland Clinic, they had no idea what was going on. And then you got referred to Johns Hopkins or Jefferson or UPMC. So I think this has just been brewing inside of me. And then I lost my mother and father-in-law one day apart in 2008, both to just medical errors. By the way, there's 1,000 people a day in the United States die from medical errors. It's like 737s dropping out of the sky every day.
Wow.
No other industry could get away with that. The car industry couldn't. The food and beverage, pharmaceutical couldn't. But
that's a ridiculous number. Every day, 1,000 people.
Every day, 365 days a year. And so, and I didn't know that until all this. Other than, and then, so I lost my mother-in-law, I lost my father-in-law. And then 4 years later, I lost my dad. Same thing. He was perfectly healthy one day, had what they thought was a mini stroke, put him in the hospital to get better. He got a urinary tract infection and sepsis and just ended up dying under care. And so, so that was pretty frustrating. And then we had this respite for about 7 or 8 years. And then Pam got sick, and right after our 47th wedding anniversary, and 2 weeks later she was gone. And it was just a series of mishaps and misjudgments. And so after that, I was sort of on a mission to say, what's going on here? And I became my mother-in-law, who will be 92 this week. She lives across the road from us here, and I became her primary caregiver. Primary, I was the closest one proximity-wise. She was surrounded by a village, but I was the one that got to take her to see Dr. Gates every other week as she was recovering from a car accident, and And so I knew Zane casually, and I knew his wife from the time she was a kid. She just grew up over the hill here from us, but never really understood his business model or his clinical model. And so as I got to see him a couple times a month for a month or two, it was like he started to explain what his mission was, primarily to offer care to the unserved and underserved members of our communities. And because he grew up in the projects, Black kid in Altoona, which is only about 2% of the population, whereas in the rest of the country it's about 12%. So true minority. And then single mom, never knew who his dad was, and then but was bright enough to get into pharmacy school. And then when he was in medical school, following pharmacy school, his wife or his mom passed away from a medical error. Actually, it was she had the wrong color card for Medicaid, so she couldn't get transported to Pittsburgh, where he was in medical school, to get the treatment she needed, and therefore died.
Holy cow!
Our missions sort of aligned. He had a 20-year head start on me in the medical profession, but we were instantly and spiritually also aligned in knowing that the Holy Spirit was guiding our actions, and this wasn't happenstance that we met. And so we started in the fall of 2022 trying to engineer everything that he had learned in the previous 21 or 22 years, and trying to engineer it into a scalable business, which he's brilliant beyond belief. But it's hard to balance a clinical profession with an entrepreneurial profession. It's rare. And so we decided to partner to start Gloria Gate CARE, and here we are.
Much more to it than that, I know, but it's amazing the journey. On this show we talk so much about making your mess your message, right? And there's something really about going through that mess in life. What else do you do with that besides make it a message, turn it into something that you help other people with and serve them with? And there couldn't be a bigger thing in the country that we live in to tackle in that message than healthcare, and doing it right and serving people at a high level it's so important. So I can't wait to dive more into this. Before we go any further, though, I want to welcome everybody here. This platform, if you're watching or listening right now, is for you to find breakthrough. That's why we are called the Unstuck Movement. We're sponsored by the Connected Leaders Academy. Check out connectedleadersacademy.com. Over 500 heart-centered entrepreneurs from all over the world. And also the Pro Podcaster Academy. If you're somebody who is an expert at what you do, you want to be the go-to authority in your space. If you want to make a lasting impact on people's lives and make incredible personal and professional connections, I'd love to help you launch that podcast. Join the waitlist at robzwentz.com. With us today is Donny Beaver on a mission to transform healthcare access following the heartbreaking loss of his wife due to coverage gaps. He is working with Gloria Gate CARE to ensure no one ever has to face that kind of tragedy again. So let's just dive into how, well, I think we all understand on different levels how defunct the healthcare system is. When you guys dove into this and wanted to change things, what was the first thing you focused on as far as straightening all of this out, right? Because there's so many things that seem to be off base. Getting to the root of the issue, the root of the problem, is always the most powerful and impactful thing to do. What was at the root of all of this, do you think?
Yeah, I've spent my whole career, I think this is my 20th venture, and I've spent my whole career scratching my head and looking at a problem that seemed intractable, and saying there's got to be a better way. And so essentially what we did was we took Zane's 20 plus years of experience in he started out with a free clinic, and he got support from the then Altoona Hospital before UPMC came to town. And they basically covered his cost to care for underserved people, for people that didn't have any insurance, or he helped them find a way to get onto Medicaid, so that they had at least a government sponsorship coming in too. But what he realized that health care, especially preventative care, is extremely affordable.
Mm.
Health insurance is impossibly expensive. And his discovery about a dozen years ago was, we try to insure the uninsurable. You
Mm.
know for sure that you're going to have to go to see a doctor once or twice a year. You know for sure that you're probably going to need a blood test. You know for sure that every 2 or 3 years, you're going to need some kind of X-ray, um, CT, MRI. Actual millions of actuarial studies have proven those things are for certain going to happen.
Mm.
You will need physical therapy every 2 or 3 years. The older you get, you need it more often. But and so those things are going to happen for sure. Just like you know for sure that you're going to have to plug your Tesla in to get electricity. You're going to have to take your Ford Bronco to the gas station and fill it up.
Mm-hmm.
You wouldn't buy insurance on that. Why would you buy insurance for something you know you're going to do?
Yeah.
And so 80% of what happens in healthcare, we can predict with very accurate 95% plus reliability. In a population of thousands of people, we can predict exactly how often those things are going to happen. And so his brilliance was, he wrote in 2012 a peer-reviewed paper with a math professor at Penn State about the system is broken because we're trying to insure the uninsurable. And if we disconnect real care and pay for that directly, and from the catastrophic stuff that happens to your health, just like the catastrophic stuff that could happen to your car, catastrophic stuff that could happen to your house, you might burn down, you might wreck the car. And if you peeled off 80% of the things that go on in healthcare are predictable and are actually extremely affordable to care for. And the more of it you do, the lower the costs get. There's nothing in healthcare where the costs go down. Only Dr. Gates' business model. And so as soon as I saw it as a guy that likes to scale businesses, it's like, that's brilliant. Now how do we uncouple it? And so he had piloted a program for 6 years before I came along with UPMC, the insurance arm, not UPMC, the hospital arm. They're two different entities. And he had piloted a program with them with about 800, we call them members, not patients. We want them to feel part of a group. And actually we do a lot of this. I've patterned the direction we're going a lot after Rick Warren's purpose-driven life, purpose-driven church. But he had taken care of 800 people, the sickest of the sick, the ones that have been most disadvantaged as far as socially, financially in our communities, but the folks he grew up with. And for 6 years before I came along, he took care of them. And it turned out over that period of time, the cost of care dropped about 35%. They were healthier. They were going to the hospital less often, which cost the insurance company less money. And he was, by all senses, he was doing a great job with that group. What he needed was somebody to come in and say, how can we scale that to 2,000 or 5,000 or 10,000 or a million? And so that's where I got involved. We took his model and then we expanded it beyond UPMC. We now have partnership with Geisinger Health Plan, not Geisinger the hospital, Geisinger the insurance company. Most people don't know there's a difference.
Yeah.
So now we can, and we're working on other insurance companies, primarily starting with Medicaid, just expanded to Medicare. And this fall we'll be expanding also into what the commercial market, so for businesses too. But we wanted to start at the end of the spectrum that he cared the most about and that he had the most experience in with, and both uninsured people who we help get insurance, and then what I would call underinsured because they can't get access to physicians because most physicians don't want to take the insurance because it doesn't pay very much.
Gotcha. It's incredible just knowing the background of where this comes from and the heart that's behind it, right? The heart to really help people and to want to change things and to really care about people, right? To really make a difference in their lives. So I'm curious on like a practical perspective when it comes to Gloria Gates CARE, how does it look differently in the functionality? So if somebody is signing up for it, how does it operate differently on like just on signing up on a daily basis than what normally would happen?
Good question. The basic idea is to consolidate all the services you would need outside the hospital. So we're not an emergency department. We don't have helicopters and ambulances. We don't have hospital beds. We don't do surgery. We don't do long-term care or the really expensive drugs, or dialysis or anything like that. So what we do is what's referred to in the industry as ambulatory care, meaning you're up and around, you're able to get to and from your appointments. You may have trouble in transportation, which we help you with, and so we basically carve that out and the regular things, and then we consolidate them in one operation so that under one roof, we have what we call a care hub. And the care hub is not just doctors and not just nurse practitioners and physician's assistants and medical assistants. We also have what I believe is one of the largest labs in the Commonwealth of Pennsylvania that's outside of a hospital. It's in an independent doctor's office. So we do all our own blood tests, same day. So we also have full-time clinical pharmacists on staff. You don't have to go to the drugstore. We keep the acute generic meds in-house. So if you have a sore stomach, an infection, a scrape or a scratch, we've got the stuff right there, and our clinical pharmacist gives it to you. If you're on long-term pharmaceutical preps, we have ways of getting them to you at a fraction of the cost it would normally be. And we do what's called MTM, medical therapy management. So we reconcile your meds for you. A lot of times, a lot of our members have seen 3 different doctors over the last 5 years, and they have counteracting drugs, and they're wondering why they feel so bad, but no one will take the time with them. We take the time. We have full-time dietitians, so you don't have to go to a nursing home or hospital to get a dietitian or be morbidly obese. We teach you how to eat things you like that will help you stay better. And by the way, they're not Twinkies and they are not Mountain Dew. But we also help you stay accountable. We surround you by a team that includes behavioral health specialists, mental health specialists, social workers, care advocates. We have our own physical therapy department, our own imaging. So X-ray, mammogram, sonogram, ultrasound, CT, MRI, all under one roof, literally one place to check in when you come in, and then we just steer you up and down the hallways. You've been over to the Station Mall before, right?
Oh, yeah.
Do you know how many different check-ins there are over there?
It's a little confusing.
Right. Just one place, just check in, and we'll steer you where you need to go. We'll take you by the hand. We actually, for a certain segment of our members, we actually offer transportation to and from as part of the deal. No copays, no deductibles, no out of pocket, because our insurance partners pay us in advance every month. It's like a gym membership. We get paid every month in advance to take care of this group of people.
It's amazing. It's amazing that you guys have made it work and are making it work, and it's continuing to grow and expand. I guess that speaks to your scale, your gifting in scalability. Also, I really find it fascinating. So because that's one of the biggest problems is people on different medications that counteract each other, and nobody takes the time to actually learn about people and where they're at. Yeah. So that's another piece of the puzzle, is like that patient care, building those relationships. Is there a certain kind of protocol or certain things that are in place that you guys, it's mandatory you do differently to actually show up for people, get to know them, and understand what they're all about and what they need?
Great question. 2 things. I forgot to mention, at the core of what we do are folks called care advocates. You are assigned a care advocate the day you sign up with us. That person's responsibility is to not just make sure that you get the physical care that we provide, but connects you with social services, transportation, a better job, spiritual, if you're suffering spiritually. So a care advocate literally is yours and goes on your life journey with you,
Wow.
and your family. By the way, our contracts with our insurance partners pay us enough to slow down, not speed up. So that's how you get to know people. You don't get to know them standing in line at McDonald's, at the grocery store. You do so the care advocate sort of wraps her arms around each patient and then coordinates with all of our internal opportunities, but then also all of our external opportunities, which include mental health, substance use disorder, all those types of things. And so it's an integrated whole person care model that my wife used to say, people don't care how much you know until they know how much you care. And that's really our internal theme. So that's one thing. And then I forgot the other thing I was going to say, but it'll pop up again.
I love it so much because it's such it's the missing piece to the puzzle when it comes to healthcare is the care part, caring about people and not feeling like you're just a number. Not saying there aren't doctors out there that don't care. There are. I mean, they do want to help, but the system kind of
beats them down.
Yeah. It kind of forces that priority to the back of the list.
Right.
And it's amazing that you guys have been able to build something that switched that around.
Yeah. And what allows us, the rest of healthcare in America operates in what's called a fee for service business. And so the more services a doctor can render, the more money he can make or she can make. And so ours breaks that model and says, no, we're a membership model and we will accept a set amount per month, whether you come in or not, whether you come in 3 times. We want to walk life with you and those closest to you, your family, your friends. I know as a family, we've always thought of healthcare as a team effort. Like there's nothing worse than going to the doctors alone because you can't even remember what they tell you. And a lot of times you can't understand. It's always good to have a spouse, a partner, a parent, a child go with you, taking notes and that kind of stuff. And that's what we do is we offer that comprehensive care where we're drawing the family and friends into the care circle. We start at the care circle and work out. And our main goal is to have you live longer and stay the heck out of the hospital as long as possible.
What a great goal to have. Makes sense. And yeah, that's one of the most confusing parts is so much information. A lot of it's just being said to you in the room and you're supposed to expected to just like retain the information, and you lose most of that through the conversation. You lose most of that whenever you leave. Like you don't even understand why you're taking what you're taking or what's happening now or what's happening to you next. It can be very confusing. So I just love the fact that you guys went after those very important pieces. I'm curious. I'm sure you guys have core values. What are the core values that you live by for Gloria Gates CARE? Well,
the mission is to hear 2 words at the end of everything: well done. Jesus, when he was separating the sheep from the goats, and he was telling the sheep, "Hey, look, when I was sick, you comforted me. When I was in prison, you visited me. When I was hungry, you fed me. When I was naked, you clothed me." And they said, "When did we do that, Lord?" And he said, "As much as you've done it for the least of these, you've done it for me."
Yeah.
And so, you can start adding all these nice vision, mission things. That's it. That's
it.
I have a bracelet in honor of my wife with Philippians 4:13, but I have WWPD. What would Pam do? Pam would stop in a grocery line when she heard a woman stumbling for change to just be able to pay for that little bucket of food. And she'd just sort of pay it forward. And I can't tell you how many times people wound up in her car praying with her. And that's the core of what we're doing is we're trying to lead people to a life well lived. Healthcare is a doorway into that. And so that it's actually a wonderful opportunity to be able to be Jesus' feet and hands and eyes and ears.
Yeah, what a great value too, just to see Jesus in everybody, that you're serving people and just doing everything that you can for them. I mean, that's the best core value you could ever possibly have.
Yeah.
And it's
Yeah.
such a simple, easy to understand message.
Yeah.
That's powerful.
Yeah.
Real quick though, we got to shout out the sponsor of the podcast. When we come back, I want to talk about, I'm very curious about your ability to scale businesses and what that looks like for Gloria Gates Care. How does this expand from where it is now? Where do you plan on going next? And just more about that gifting and what that looks like in your own life. So we'll talk about that in 1 minute. Are you struggling to make consistent, valuable content for yourself? Do you want to have an efficient and effective way to create content that attracts the people that you want to connect with in life, the people you want to build relationships with in business? Do you want to be the go-to authority at what you do, at what you're great at? Would it be helpful for you if you had a platform that connects you to incredible people in your industry? The kind of platform that gets you leads and lands you clients without you having to beat down anybody's door or blow up anybody's inbox. Whether you're already creating content or you're desiring to start and it's something that's been kind of burning inside of you for a while, I urge you and encourage you to check out the Pro Podcaster Academy. Get started right now. Join the waitlist at robzwentz.com.
Hi, my name is Jose Escobar, and I'm the founder and CEO of the Connected Leaders Academy. We're a growing tribe, a community of entrepreneurs all over the world globally. If you're an entrepreneur and you're looking to grow personally and professionally, scale your influence, develop your skill sets, move the needle in your business, more clients, more money, more profit, the bottom line, and of course, grow your circle and your network like never before, join the Connected Leaders Academy today. Check me out on Instagram and on Facebook, the @ JAESCO25. We look forward to having you join us. Take care.
Loving this conversation, Donny, and also just knowing where your heart is at in all of these things, and Dr. Zane Gates. And when we talk about scalability, like what have you seen? What are the biggest roadblocks? What have been the biggest challenges to overcome as you've been building this?
Yeah, I've been an entrepreneur since 1972. I've never really worked for anybody but my customers. And so one of the blessings I've had is a lot of failures along the way in trying to figure out how to scale businesses, and then developing this never-ending inquisitive attitude toward things. It's like, why isn't that working? Why did we try this and we didn't grow? Oh, wait a minute! Look at this little thing that's over here. We call them tall poppies in the garden. Like, which one's sticking up the most? And like, maybe it's time to just harvest the rest and throw them in a dung heap so they can serve as fertilizer. And let's grow that poppy, and let's figure out if we can take the seeds from that poppy and grow it. So the Gloria Gates CARE journey has been a really interesting one, because at first, logically we thought, well, where are people who are underserved hanging out? And can we at least go to those places and hang out with them, and hopefully get a handful of people at a time or a dozen people at a time. So we started in January of 24. We had 800 members, and we started out saying, they hang out at soup kitchens, they hang out at homeless shelters, they hang out at food banks. They hang out at Easter egg hunts, believe it or not. And so Valerie, bless her heart, she built a team of people to hang out at 30, 40 parades, county fairs, 30, 40, 50, 60, 70 events per month. And then what we discovered real early, if you had somebody hanging out there that had a real tender heart and got a good conversation going, our potential member was always distracted with getting their car loaded with the food they just picked up, or eating their meal and getting the heck out of there. And so we discovered real quickly that it's really hard to get a long enough attention span to do something to sign them up that would take a half hour. And so then we started saying, well, why don't we send professional enrollment people with our outreach people? And so the outreach person says, hey, come on over here and sit down with Bill. And then Bill is a professional who came out of county assistant's office, and he knows how to get you signed up. Well, as the more we went with that, we started to realize that there was so much friction in that system because you have to get the insurance company on the phone. The potential member has to agree to accept you as your doctor and that insurance. And so then we tried to separate the process and say, okay, let's get busloads of people. We'll just sort of truck them in, and we'll have the enrollment department in one place, so we really and we were very successful. We started going to addiction recovery centers. Every Monday. You cannot believe the pandemic of 60, 70, 80 people showing up on a Monday morning at one addiction recovery center, probably in your backyard. And they're easy to sign up because they're sort of like, I'll sign anything. I just want to get better.
Yeah.
And so they take care of their addictive health or their use disorder health, and we take care of their physical and social health. And so we thought that would be an ideal place. And so by the end of last year, we had grown from 800 members to 3,500 members, and we thought we had it figured out. And then we realized by the first quarter of this year, just 2 months ago, that a lot of the people we were signing up were transient. We probably should have known that, but we were so excited that we were helping so many people. And they disappear. And when they disappear, we're still responsible for their health. So if they move back down to York or out to Pittsburgh, and they just show, and almost all these folks like to show up to an emergency room because they're open 24/7 and they can't be turned down. All of a sudden, our partners, the insurance companies, get a $5,000 bill for a snotty nose. And so we got just clobbered in January and February with, okay, that's not the right right way to grow this thing. So we pumped the brakes on, especially on the most transient folks. And we met with our partners there and we just said, look, we're going to be happy to take people who reside in Blair County. That would be great. If they came in from outside of Blair County, we're just not ready to take care of them yet. So let's just be careful how we select. But at the same time, too, Valerie had started a program about a year ago, going around to doctors, dentists, chiropractors, clinics, hospitals, and saying to them, look, we know you don't get paid very much to take care of Medicaid patients. And what if you would refer them to us? In the healthcare industry, you can't pay a referral fee. So it's just out of the goodness of your heart, would you refer them to us? And then in exchange, that opens up your schedule to take on commercial patients that can pay about 4 or 5 times as much to you. So you benefit from it. The patient benefits because they get in a better care program, and we benefit because we build the membership. So pretty much that program was just slowly building. And then when we pivoted in March, we said, let's take our resources and turn them to that. And so, and then now we're actually signing up doctors as partners who get to keep their patients. They fall under our program for the Medicaid part, and they do the initial intake and the regular visits, and then all the other stuff we offer, they ship them over to us, and we take care of that. And now we have a scalable model.
That's incredible.
But
yeah, well, that's part of the process, and especially, has anything like this been done before in healthcare anywhere else in the United States?
There are some programs. There are some programs that have scaled really well, but they haven't focused on the Medicaid population. They've focused, it's any business, right? Follow the money. So where most of the money has been the last several years has been a Medicare Advantage, and there's the insurance companies get paid maybe twice as much to take care of Medicare Advantage people as they do to take care of Medicaid people. So a bunch of people went after the Medicare Advantage market and tried to figure it out, and then realized, but they didn't have the subscription model rolled into it. So they were growing, but it was still based on that fee for service model. So there may be somebody out there doing it. I always like to say, it's no fun playing basketball or tennis by yourself. I just wish there was somebody else that we could compare ourselves to right now.
Well, that's what I'm saying. Like, you guys are like reinventing the wheel, and like, who do you go to? That's exactly what I was thinking. Like, people to bounce ideas off of, to share stories with, to
Right.
just ideas on how to grow and what pitfalls to watch out for. I feel like you're really building something that is going to be super helpful for other organizations that come along that want to do something similar, because this is, obviously, it just seems logical. This is the direction we're being pushed into because of how broken the general healthcare system seems to be, or how just out of whack it seems to be. So I love the idea that it's happening in Blair County in Pennsylvania. And I'm curious, just I'm a man of faith, I know you are as well. How has God played a role for all of this in this process? Like, I'm curious for you, just like, how has he shown up, the insights you've been given, and like doors that have been opened that you don't think ever would have been opened otherwise?
Yeah. I did want to back up a step, if you don't mind, because
sure, go ahead.
Because your Connected Leaders Academy is a similar group of how I grew up in business in the 70s and 80s with a company called Service Master, which, by the way, was a cleaning company, cleverly disguised. It was a faith-based organization, cleverly disguised as a cleaning franchise company.
Oh, but really? I didn't know that. Okay.
Yeah. So we had there were 3,000 franchisees in the United States. I was responsible for about 50 of them in Pennsylvania. And it was the same idea. We were in non-competing markets, so we could share ideas with each other, and we could catapult our businesses by learning from one another. And that really served as a foundation to help me think about scaling. And that's why I think we're trying to build we want to be in every county of the United States in 10 years. And we're not going to be able to do that ourselves. We're going to have a connected group.
So that's the goal, every county in the United States in 10 years.
Yeah.
Amazing. What a goal to have. Cool.
Yeah. Right now, just on Medicaid alone, 75 million people are on Medicaid in the United States. I can't take care of 75 million. If we get to 1 million, we'll be a multi-billion-dollar company. So we need people coming alongside of us, because this mission, healthcare is going to be broke in 3 to 5 years, and if we don't conscript other people into our model, and we can scale successfully for me and my investors, but we can't scale successfully for what this country really needs.
What does that mean, that healthcare is going to be broke?
Well, so right now I told you it's $28,000 a year to take care of a family of 4. Within 5 to 7 years, at the current trajectory, which has been going on since pre-COVID, at the current trajectory, to take care of a family of 4 by the early 3033, I think they say, it'll cost the same as the median family income. Median family income currently at $75,000. It's going to cost $75,000 to take care of them.
Jeez.
The canary in the coal mine is look at independent pharmacies. Do you know many?
No.
They got squeezed out first. Next one is small rural hospitals. In the year 2000, there were 120 in Pennsylvania that weren't affiliated. They were just Tyrone Hospital, right? Yeah. Nason Hospital. There's only 11 left. They've all been gobbled up by these big companies. And so and there was just a recent meeting of CFOs of major health systems in the United States, and their confidence level that the industry was going to be sustainable for more than 3 years was at 3%.
Oh, jeez, Louise.
Yeah.
Okay.
Yeah. So, but anyhow, back to your other questions about how God fits in.
Yeah.
And how he shows up. I don't know. Are you a fan of Max Lucado? Do you know Max Lucado, the Christian author?
No, I don't. I've heard the name. Yeah. I don't know.
Yeah, great author. But we're doing a book study right now, a care group in actually, it's not even affiliated with our church. It's just a bunch of us that got together, and we're studying the book called Never Alone. And it's about how God shows up in the tiny moments and in the big events.
Mm-hmm.
And if you don't look for him in the moments, you're probably going to miss a big event. And so the idea is, you just have to trust that and there's nothing too small, nothing too trivial, nothing too big. It's everything. And so I think, and in this case, we've been able to attract one of the leading physician, author, speaker, podcasters in the United States to become our CEO. Just, you can't explain it. He lives in Charlotte, North Carolina. We read his 2 books. His name is Dr. Zev Newworth. We read his 2 books last year. I invited him up to see what we were doing for a day. He came up, and at the end of the full day with us, he said, "This is a holy grail I've been looking for 30 years. Can I consult with you?" So he consulted with us from May till September. In October, he joined us full time as our CEO.
Whoa.
We're a dinky little startup. He was working at $40 billion organizations. So that's one of those ones that how do you explain it other than the hand of God?
That's amazing. His name, you say his name is Zev?
That's Dr. Zeev Newworth, Neuwirth. We haven't even really made the formal announcement yet. We've just sort of been quietly flying under the radar. But he has the longest running healthcare podcast. He's doing his 200th episode this week. Does it every 2 weeks. He's been doing it, I think, 13 years. And then he's an author of 2 books, a regular keynote speaker at big healthcare conferences, and he writes on why is it broken? His first book was called Reframing Healthcare. How do you reframe the problem to be able to think about it a different way? And when he saw Dr. Gates' model, it's like, you guys have already cracked the code. Why don't more people know more about this? And it's like, well, we're about to try to let them know.
Yeah. This sounds like the catalyst for that to happen, right? That's incredible.
Yeah. And the second thing that just is beyond explanation, we were told early on that you're not going to be able to attract capital. And we knew we were going to need a lot of capital to expand this business. You're not going to be able to attract capital. You're going to need millions and millions and millions of dollars.
Yeah.
Just in less than a year, no, it's a little over a year now. We've been able to attract 50 different families to come alongside of us from all over the United States, as far away as Florida, Idaho, Texas, to invest with us in our mission. We've raised more than $10 million so far. We've got about another 50 to 100 million to bring in the next 2 or 3 years. But we've been doing that all just with a family and friend network. And now we're about to, matter of fact, my next call today is with a group of investment bankers who've agreed to help us really scale from there. So it's beyond explanation, because everybody said, yeah, you can't do that.
Yeah.
And it's only God. That's the only way I can explain it.
Yeah. Well, it's so true. I mean, when you're faithful with a little, right? And that's what happens. Starting with a little, starting with the people who needed it the most,
Right.
Suffering the most, serving them, and just slowly growing and having that heart. Like you said, that, seeing Jesus in everybody and serving those people. And that's a little bit, person by person, day by day.
Yep.
And then huge things start to happen.
Yeah.
And God shows up in little ways, little ways, and then in very big ways. So, Donny, absolutely amazing, man. It's amazing that it's here in Blair County, and it's amazing. Number one, it's just incredible that the healthcare system has gotten to where it's gotten, and it's so chaotic, but that you guys are cracking the code on this, and that people are starting to recognize it, and people's lives are being changed. I was on the website, which I encourage everybody to go to, GloriaGatesCARE.com, and the testimonials on there. If you just go on to the testimonials, it just goes and goes and goes. You guys have so many.
Yeah.
I was reading through some of them, and I was just very touched by it.
Lives changed. an audacious, are you familiar with the term BHAG?
Yeah, the big hairy audacious goal.
So our BHAG is Blair County has done an incredible job positioning itself as the first frontier. Do you realize that Altoona, Pennsylvania was the original Silicon Valley? It was the heartbeat of the world's technological innovation with the railroad, with the Pennsylvania Railroad. 17,000 people were employed in Blair County in the late 1800s. No one had figured out how to get around the mountain until J. Edgar Thompson engineered the horseshoe curve. Doesn't sound like a big deal, but this was Detroit before Detroit was Detroit. This was Pittsburgh before Pittsburgh was the Steelers. This was Silicon Valley before Silicon Valley, and we were the first frontier. We want to be the next frontier because the railroad is 7% the size of healthcare. All railroads combined is 7% the size of healthcare. So we have an outsized opportunity to make Altoona, Blair County, the mecca of healthcare. And so I go to work every day on not just with the idea of serving people, but to revolutionize why people want to come to Altoona. Dr. Newbush said it the first time, he never even heard of Altoona before. And so that's my BHAG.
Yeah, what a vision to have, what a goal to have. And it's one of the most important things. I mean, our health, as far as us being healthy as a country, I mean, it's at the top of the list. You got to get your health right before you can do anything else that goes along with that. So it's just so cool. And it's cool to hear the story from your perspective of like how this has evolved and where it's heading. And man, God bless. It's amazing how God's moving. So I'm honored that I had a chance to chat with you today. I encourage anybody watching or listening, go to the website, see what is happening, gloriagatescare.com. Even if you're not in the Blair County area, because eventually within 10 years, it'll be in your area also, right? As you guys continue to expand with that goal. Anything you want to leave the audience with as we sign off?
No, that's a really good point, Rob. The goal of the next 5 years is to have 10 care centers. We have 2 right now, one in Altoona, one in near Bloomsburg and Berwick. And we want to have 8 more, basically serving the suburban and rural areas at first. But we're already getting tugged to Pittsburgh, to Philadelphia, to Baltimore by potential partners who want to see this model scale. So that's if you're interested in your area, this is a community asset. One of the other main things is because a lot of our investment dollars came from central Pennsylvania. We see it as a way to uplift our community. We've created about 80 jobs just in 1 year, and those jobs are staying here. We're not shipping them off to somewhere else. And so the concept is this is a community asset that we can be proud of, not something that's owned by some big corporation afar off. So I'm, if you want to reach out to me on Facebook, I'm just Donny Beaver. There might be another one. I don't know, but
it's a pretty unique name. I feel like there's probably not too many Donny Beavers.
No, I understand there was a Don Beaver who was one of the owners of the Pirates at one time, some guy from North Carolina, but I don't think he's Donny. So.
All right, there we go. So Donny Beaver, find him on your 30,000 followers on LinkedIn. I can add to that. Yeah. Cool, man. Well, this has been great. Thank you for joining us today. Another incredible, true testimony of breakthrough. Until next time, this has been the Unstuck Movement.